The lung is designed for extremely efficient gas exchange. But this efficiency comes at a cost. The structures responsible for gas exchange are very delicate. Because of this, a wide range of diseases can disrupt the lung function. To understand respiratory pathology, we first need to understand how the lung is organized. I'm Nabeel, this is Pathocyte. In this video, we'll cover three things. First, the basic structure of the lung. Second, the major components of lung disease. And third, a simple framework which will help you understand any lung disease. Air enters the lung through the trachea. The trachea divides into right and left bronchi, which further divides into 3 bronchi on the right side and 2 on the left. The bronchi further divide into smaller bronchioles. Bronchi have submucosal gland and cartilage, while bronchioles lack these. This distinction is important in several airway diseases. The function of the lung is simple. Lung provides oxygen to the body and removes carbon dioxide. Efficient gas exchange is facilitated because of two factors. One, the lung has large surface area which is created by millions of small balloon-like air sacs called acini. 2. Within the acini, the distance between air and blood is very thin, allowing gases to pass easily across. This design helps lung to exchange gases very efficiently, but it also means lung can easily be damaged by diseases. Beyond the terminal bronchiole lies the acinus, which represents the functional unit of the lung. The acinus includes respiratory bronchiole, alveolar ducts, alveolar sacs, and lots of alveoli. Acinus includes all of these. But gas exchange mainly occurs at the alveoli. Let's look at the structure of the wall of the alveolus, also called the alveolar septum. From blood to air, it contains 3 important components. First, the capillary endothelium along with the basement membrane. Second, the interstitium, which contains elastin, collagen, some fibroblast-like cells, mast cells, etc. And the third layer is alveolar epithelium, which includes type 1 pneumocyte and type 2 pneumocytes. The type 1 pneumocytes are flat cells which cover 95% of the alveolar surface area. They allow air exchange between blood and the alveolar space. Type 2 pneumocytes are taller cells and they produce surfactant. The surfactant reduces the surface tension within the alveoli and prevents it from collapsing. Type 2 pneumocytes are also important in repair of the alveolar epithelium. The alveolar spaces also contain alveolar macrophages. They ingest any foreign material which we inhale. They also eat up and remove inhaled microorganisms. In people living in very polluted areas, we often see macrophages filled with black carbon particles. Now we come to an important concept in respiratory pathology. Most lung diseases primarily affect one of three components. First, the airways. Second, the gas exchange area, which includes alveoli and the interstitium. And third, the pulmonary blood vessels. Bronchial asthma, chronic bronchitis, bronchiectasis, etc. are diseases which affect the airways, while interstitial lung disease affects the interstitium. Pneumonia is an infection which affects the alveoli. And the diseases of the blood vessels include pulmonary hypertension and pulmonary embolism. However, these compartments are not completely independent. Disease of one compartment can cause secondary changes in the other compartments. Now, let me give you a 3-question framework which will help you understand any lung disease in this series. Whenever you study a lung disease, ask 3 questions. 1. Where is the disease? 2. What process is occurring? And 3. What does it do to gas exchange? These 3 questions become the thinking template for respiratory pathology. For example, bronchial asthma. Where is the disease? Airways. What process is occurring? Inflammation and bronchoconstriction. And what does it do to gas exchange? Airflow is obstructed. What about pneumonia? Where is the disease? Alveoli. What process is occurring? Inflammatory exudate filling the airspace. What does it do to gas exchange? Reduced gas exchange because of this exudate. So, before we begin studying individual lung diseases, remember 3 key ideas. 1. The structure of the lung which allows easy gas exchange. Second, the 3 structural compartments of the lung where diseases can primarily affect. And finally, the 3-question framework which can help you understand any lung disease in this series. In the next video, we'll look at lung carcinoma, which is the most important topic in this entire series. Think at the cell level.